Dr. Ardash, of course, before we went for break, there was that aspect of course, tobacco, we're talking about the symptoms and the causes. But some people would say, well, I don't smoke, all right, but I chew tobacco. Is there a risk
Yes.
just chewing in itself?
Yes, yes.
Yeah?
So any tobacco in any forms it's not a good thing.
All right.
Okay, even in India there is a habit of taking tobacco, chewing tobacco in along with a betel nut. Okay, that's they are known because it is associated with what they do. They chew and they keep in the mouth for longer time.
Yes.
So it is associated with exposure of the normal mouth, the oral cavity structures to these agents for a longer time. So it is associated with development of oral cavity cancers.
Okay.
Yeah.
All right. And of course, we also, before we went for break, we talked about the different areas in the mouth that, of course, the cancer can affect. But just in case someone missed it, and it's very, very important for us to also emphasize on the same, can we talk about them then? What are some of the areas that are affected? And can one have like all of them? Let's say on the lips, on the tongue, the gums.
There are not the cancers, there could be changes in most of the part, like in the hard palate, there could be these white patches I told you. So there could be present, white or red patches could be present in multiple sites in the mouth.
All right.
Okay. But cancers can arise in one site or multiple sites. We have seen, rarely we call it as synchronous cancers. In the cancers in the tongue, the cancers in the deeper, like hypopharynx, larynx, and they could arise together or they could present later. Once one site is treated, the other side can come up. There are chances. Okay, but it depends on the patient's immunity. It depends on the patient's the mutation status, all those things.
All right. Okay, and of course we'll talk about that later, the chances of recurrence of the same. Now let's talk about the staging. We talked about it earlier on, the precarcinoma and all those, but just in case again someone missed it. Now more in depth from how do you stage them then? Is there like stage 1, stage 2, stage 3, which we all know for the other types of cancers, or for oral cancers different?
It is more like similar, like the staging we start when already there is established cancer.
All right.
Like stage 1 is very small tumor. It depends on the size of the tumor because of the location. We have different location, different staging. Basically, stage 1 and 2 they are called as early stage cancers, where the tumor is located. If it arises from the lip, it is located in and around the lip, not extending to deeper structures or surrounding structures.
Okay.
Stage 3 we usually call there is a locally advanced tumor. Stage 3 and 4A, where the tumor can present with a lymph node in the neck, which is quite big, number of lymph nodes involved. It depends on those things. But still stage 3, stage 4A, it is locally advanced tumor. We have stage 4B, which is 4B is also locally advanced. 4C is the one where the cancer has spread to different organs. We have 1, 2, 3, 4A, 4B, 4C.
All right.
Okay. 4C is the one when the cancer has spread to other organs like bones, lungs, liver. Okay. But still from stage 3 to 4B, up to 4B we can manage like a curative cancer.
All right. All right.
Yeah,
Okay.
curative.
4C is now like the serious part, all right, over stage of the cancer. Okay. Then how, in terms of the seriousness, I know for the other types of cancers like breast cancer, cervical cancer, and all that, they tell you stage 3 and 4 is like a really, really serious stage, and of course stage 4, really there's nothing much that can be done. So for the oral cancer, when do you start considering it like really, really serious? Is it 4C?
Actually, all cancers are like, if it is not treated properly,
of course they become serious. Okay. Yeah.
But like I told you, stage 1, 2, they're 1, 2, even 3. They're curative cancer. 4A, 4B, even also they can, if they respond well to the treatment, there are chances of around 20 to 30% chance of cure in them. Stage 3A, stage 4A, 4B. Stage 4C is the one which has spread to other sites. Usually the goal won't be curative, it will be palliative, like to palliate the symptoms, to improve the symptoms, to improve the quality of life.
Yeah.